The second and the final presentation for today shall be taken by Haggai Silas. Haggai Silas is a certified dental therapist, a graduate of Federal College of Dental Technology and Therapy, Enugu. Silas holds a postgraduate diploma in public health from the University of Maiduguri and a master's degree in public health from the National Open University of Nigeria. At the moment, he is working with Public Health Emergency and Operation Center, Gombe State. He is also a volunteer with Ask the Pediatrician Foundation and Zero Norma Initiative Nigeria. Silas hails from the Katango local government area of Gombe State. So Silas will be speaking to us on overview of complementary and alternative healthcare practice. Silas, you may now proceed. Please unmute Silas so that he can make his presentation.
Good morning, everybody. I stand on the existing protocol. I want to thank you very much for this opportunity and privilege to speak this morning. I will be speaking on the overview of complementary and alternative medical practice. With me this morning, my presentation will be focusing on in the introduction, the overview of complementary and alternative medicine, the categories of complementary and alternative medicine, some examples of complementary and alternative medicine, challenges of complementary and alternative medicine, and then my conclusion and the way forward. My introduction. My introduction. The National Center for Complementary and Alternative Medicine defines complementary and alternative medicine as a group of various medical and healthcare system practices and products that are not presently considered to be an aspect of conventional medicine. What does that mean to you and me this morning? If you talk about complementary and alternative medicine, it is a practice that has been in place by so many communities and individuals. When is medical practice said to be complementary, and when is medical practice said to be alternative? A medical practice is said to be complementary if it works in conjunction with the conventional medicine. For instance, if somebody wants to take paracetamol, which all we know is an aspect of conventional medicine, some communities or some individual may believe that if you combine the paracetamol and maybe other herbs or leaves, guava leaves, mango leaves, or other things, it may give effective, remedy to the treatment at hand. So combining the alternative medicine, which is the herbs or the leaves, and the paracetamol at the same time is known as complementary medicine. On the other hand, alternative medicine talks about substitution, that is using other form of remedies instead of the conventional medicine. That is keeping the paracetamol aside now and concentrating on the leaves and other herbs in order to remedy our situation. Of course, A good number of complementary and alternative users take it concurrently with conventional medicine. However, some patients who use herbal products do not inform their doctors or healthcare providers due to fear of physicians' criticism or because the physicians fail to ask. In addition, most complementary and alternative users practice self-medication without guide or supervision from licensed and certified practitioners, camp practitioners, sorry. I want to say at this point in time that it is not a crime to use complementary and alternative medical practice, but it is supposed to be with the consent of a trained and certified medical doctor or a physician, which will guide us in order for us not to have any effect. I will be talking on the overview now. Next slide. Overview of complementary and alternative medicine. Many studies have reported potential benefit from the use of complementary and alternative medicine. There is little evidence regarding its safety and efficacy. Majority of complementary and alternative medical practice users perceive them to be natural and safe, but are unaware of their composition and potential harmful effects. Different communities have different complementary and alternative medical practices and beliefs, and its ability to remedy disease and other health conditions. So at this point in time, I want to say that it is our responsibility as health practitioners to educate our patients or our clients on the right medicine to use and the right alternative or complementary medicine to use. We can substitute them, we can, combine them with other things so that we can get the effective treatment that we may need. Next slide. Categories of complementary and alternative medicine. The National Center for Complementary and Alternative Medicine recognizes 5 main categories. The first category is mind-body medicine. These include treatment that focuses on how our mental and emotional status interacts and how it affects the body's ability to function. Examples include meditation and various therapy expressed through art and music. The second category is whole medical system. This category refers to complete system of medical theory and practice, many of which go back thousands of years and have roots in non-Western cultures. Examples include traditional Chinese medicine and Ayurveda. What is Ayurveda? This is a preventive and not a curative practice. It is done through exercises, combination of diet, and lifestyle changes. Another example of whole medical system is the homeopathy. This is a medical practice that is based on the idea that body cures itself. It uses plant and mineral substance for treatment. The next category I want to talk about is the manipulative and body-based practice. This relies in the physical manipulation of the body. The practice is intended to improve specific muscles relaxation and overall health. Example include massage and acupuncture. Another category that I'm going to talk about now is the energy medicine. This form of alternative medicine uses energy fields to promote healing. One of the examples is the use of electromagnetic field to cure or to treat fractures. In this kind of treatment, the electromagnetic device is inserted into the bone, and the electromagnetic energy is transmitted into electric energy, which work on the bone and triggers the bone to work the way it is supposed to. The last category I want to talk about here is the biologically based practice. Since The inception, the focus is on herbs, nutrition and vitamins, dietary supplements, and herbal medicine. In this aspect, we want to, our focus here is on herbs, roots, and other, traditional medicine that is used by individuals and other communities in order to cure diseases and other ailments. Some examples of complementary and alternative. Next slide. Some examples of complementary and alternative medicine. Number one is acupuncture. What is acupuncture? Acupuncture is a Chinese indigenous traditional medicine in which solid metallic needles are inserted into the skin with hands or electrical stimulation. It helps reduce pain. However, it works scientifically remain unclear. In this kind of remedy, the use of pins is used to be inserted inside the body under the skin in order to treat pains. But most of the times, this practice is being done without knowing the scientific background of how it works. The next example is massage. This involves rubbing and moving the muscles and soft tissues of the body using the hands and the fingers. The essence of this practice is to increase blood and oxygen supply to specific area of the body. The increased blood supply causes relaxation of tense muscles and nerves, relieving pains and tension. Acupressure. Acupressure is a combination of acupuncture and massage at the same time. That is the combination of using pins under the skin and massaging the skin simultaneously in order to achieve the desired result. Another example here is the osteopathy. The major focus of osteopathy is orthopedic and rheumatic disorders. It is based on the principle that diseases are chiefly as a result of lost structural integrity, which can be restored by manipulation. In osteopathy, the dysfunctional structure is restored through physical manipulation, and hence health is restored. Another example that I will talk about here is the chiropractic. The focus of chiropractic is to align the spine or any other part of the body that has lost alignment, causing pain to the individual. Is that relationship of the spine with the nervous system affected, and so the loss of proper alignment of this body part is believed to cause dysfunction and body pain. The chiropractor does this alignment, thereby relieving pain and improving body function. The last example I'm going to take here, second to last, is aromatherapy. This practice uses the application of essential oils from plants and other aromatic compounds to alter the mind, mood, and cognitive functions for health. It is applied in situations where there is need for reduction of pain and anxiety, need for enhancement of energy and memory, and need for relaxation. Some school of thought is of the opinion that the aroma influences the brain through the olfactory system. The essential oils equally exert positive effect on the individual, producing feeling of well-being. In aromatherapy, we just kind of put some leaves and some oils, and the patient or the client in question perceive the aroma. As a result, it alters mind and change his cognitive, thinking. At that point in time, he will be calmed down and he will be reassured so that he will regain his mental well-being. The last example here is phytomedicine. Phytomedicine is the use of herbs with therapeutic properties for treatment of diseases and other health conditions. It is the practice of herbalism, preparation of herbal drugs, and has always been with humanity. Herbalism is traditional medical practice, but in modern times, remedies are explored and turned into to drugs for the treatment of various illness. Next slide. The challenges of complementary and alternative medical practice. Despite the importance of this complementary and alternative medical practice and its effectiveness recorded by so many communities and individuals, it has some challenges and limitations, but I want to speak on just 5 out of them. First is contamination and adulteration. If we talk about contamination and adulteration, we are talking about the impurity of the practice. For instance, some of the traditional medicines, we don't know the water the people use in making, the medicine. Some of the water may be contaminated, some of them may be impure, and as a result, if a patient or a person take it, it will cause more harm than good. The second challenge concerning complementary and alternative medicine is poor scientific framework and standardization. As we all know as health practitioners, before any drug or any medical remedy is being, patronized or is being approved, it has to undergo clinical trials. But in complementary and alternative medicine, most of the things that have been in use have not undergone that clinical trials. There is no scientific explanation of the constituents and the methods of usage, the dosage to take, and all those kind of things. As a result, it causes more harm than good when taken. The third challenge I'm going to take here is exposure to toxic substance. On this note, I want to say that most of the times, the consumption of these traditional remedies cause what we call drug-induced hepatitis. It has serious effect on the liver. If the liver is being exposed to this kind of, remedies, it may not feel good on the liver. As a result, it will cause hepatitis and other ailments on the liver and other body parts. The challenges number 4 is the tendency of displacing or interfering with conventional treatment. In a situation whereby a person is taking conventional treatment and complementary and alternative medical practice at the same time, this complementary and alternative medical medicine that a person is taking at that point in time may alter the effectiveness of that conventional medicine, or it will make it to have another side effect, which will in turn have negative effect on the consumer. Some may cause deadly interaction. If we don't know the scientific background, the makeup of the practice in question, it may interact with some of the drugs we are taking conventionally, and as a result, it will cause deadly interaction and have serious effect on the patient, causing the patient to lose his or her life. What are the way forward since we've known the challenges now? There is supposed to be way forward so that the use of complementary and alternative medicine will be effective in the community, to our patient and to our client. The first way forward here is medical school curricula should be expanded. Most of the times we find out that in our medical schools, the aspect of complementary and alternative medical practices are not actually dealt with. We just focus on conventional medicine, but if you come out to practice, we find out that we are faced with these kind of challenges. So if the curricula of medical students is being expanded so that this practice is being included since in school, it will give health practitioners idea to have the knowledge of this kind of practice, so that if they come in contact with any patient or client that is involved in this kind of practice, they will know the remedy to give, they will know the advice to give, and they will know the treatment plan to embark on. The second way forward is supporting and conducting basic and applied research about CAM practice. This is supposed to be the work of the government and other agencies to, set a body that will encourage research of this complementary and alternative medicine in order to know its effect, its efficacy, and other things concerning it, so that some of them will be completely eliminated and some of them will be encouraged in order to improve the well-being of our patients and clients. Training of complementary and alternative medical practitioners by the national training of complementary and alternative medical practitioners. We found out that in most communities, there are some people that are known as practitioners of these complementary and alternative medical practices. So the government, or let me say the Ministry of Health, are supposed to partner with them in order to train them properly so that they will discharge their duties properly. Another way forward is dissemination of information through expand outreach on the safe use of complementary and alternative medical practices. This calls for action on the healthcare practitioners. I want to say at this point in time that it is your duty, you and me as a healthcare practitioner, to reach out to our communities, churches, mosques, and other gatherings in order to educate them on the negative effect on the use of these complementary and alternative medical practices, so that whenever they want to get involved with that practice, the hospital to seek the consent of their doctor or their physician. My conclusion: the improper use of complementary and alternative medical practice has caused so many medical complications and resulted to death of many people. Medical practitioners should take it as their responsibility to dig deep into the patient's medical history to obtain information which will help them in decision making and the type of treatment option to embark on. I want to say at this point in time, anytime we have contact with our patients in the hospital or in the community, it is our duty to investigate the patient's medical history, to ask questions on the kind of remedy the patient has taken before he comes to you, so that if the patient is on that complementary and alternative medical practice, the first thing we need to do at that point in time is to refer him to the laboratory in order to investigate the liver. We call it the liver functioning test, so that if there is any effect on the liver, we stop that practice, we will stop that medical practice at that point in time and replace it with a better one or with a conventional one. And if there is no any consequence of that practice, we encourage him or we combine it with the right one so that our patients will get well. Thank you very much for your time. I appreciate you all. Thanks.
Thank you very much, Silas.